Good evening, everybody. Thank you for coming. I'm really excited to introduce you to a very special guest, my good friend Joe Tafur. He's a medical doctor and he's also a shaman. And he wrote a new book called Fellowship of the River, which is quite fascinating. And it goes into how shamans approach healing the body, because a lot of us have a lot of medical conditions and we're not getting any better. And the allopathic model doesn't offer any solutions. But going back, to the ancient wisdom of the shamans and bringing that now into our world here, it's offering a fresh perspective and new hope for people. And so Joe's going to be talking to us about ayahuasca and epigenetics, and it's just a fascinating topic and fascinating talk. And without further ado, Dr. Tafur.
Thank you very much, Nikki. Thank you, and thank you to Dr. Bergman for having me here. It's a nice opportunity to talk to you guys and to be on the podcast or on the internet. So yeah, I'm here. I'm touring, promoting the book Fellowship of the River, which is like you said, it's a story. So it's trying to be an entertaining book, interesting book that way. A story about my journey from medical school, having a hard time there. Getting depressed in medical school, looking for help, trying to find answers for myself, and then eventually, after trying out a few different things, getting help with plant medicine with peyote in the Southwest. I'm from Arizona. I grew up in Arizona, and really changing things for me and turning me around, and then getting very curious. My dad is a psychiatrist, getting very curious about why that kind of medicine wasn't more widely available, or why no one's really talking about it, no one told me about it in medical school, etc. And then eventually I got curious about what was going on in South America, because my family's from Colombia, and so I knew about a lot of people going down to try ayahuasca. I don't know if you guys have heard of ayahuasca, some of you may have heard of it, but it's a traditional plant medicine from the Amazon, from all over the Amazon, Brazil, everywhere, all across. And a lot of people are going down there, and so I ended up going down. I had a big experience. And then I ended up bringing groups, people to go down for healing, and then eventually I got very involved and I helped open a healing center there. And I worked there for 6 years. And during that time I also trained in the shamanism, to learn ayahuasca shamanism, learn about what was going on and how people were getting helped. So in that time, as a doctor, so in the book I present, that story, and then I start presenting cases, and then here I was hanging out and then somebody showed up with this problem and somebody showed up with this problem, and trying to figure out as a doctor, what could I say about how these people were getting better and what does that say about our medicine. And so a lot of these people, they had all been to the doctor, they had all been to the psychotherapist or the psychiatrist or the different kinds of allopathic medicine. Maybe they didn't go to the chiropractor, they probably needed a chiropractor, but some of them missed out on that and they ended up coming to Peru. And so a lot of these people got better from problems that they weren't getting better from, after years and years of Western medical treatment. And so, how was that possible? What is it that happened to them? And that's what I was curious about. So the book ends up being a presentation of those cases and then some theory about why do I think that is. So I'm going to try to present some of those theories. I just presented this same material at the MAPS conference, Multidisciplinary Association of Psychedelic Studies, recently in the last couple of weeks. So it's called The Potential Role of Epigenetics in Ayahuasca Shamanism. So I'm going to try to explain a little bit what's epigenetics and tell you guys a little bit about Ayahuasca Shamanism. So this is just, some little shots from being down there in the jungle and working, not with the university, but working in the jungle with a staff from Peru and living with the patients and getting to know people and getting a little more insight. In a retreat, people were staying for days or weeks, getting to know what people were going through and what brought them there. And this was the center I used to work at, Niue Rao Centro Espiritual, which still functions. I'm still consulting and bringing groups there. That's their website. That's some of the treatment team. So one of the things that turned me on and got me into going down there was this book by this anthropologist, The Cosmic Serpent, and then he also wrote this book, Intelligence in Nature, this guy Jeremy Narby. And he had been down there drinking ayahuasca with the shamans and had these experiences and these visions that made him feel like he understood something about what they were doing. Like, how was it that they were interacting with people and making a difference with people? And he had this experience, and he said, I began searching for common ground between indigenous knowledge and Western science, and ended up finding links between shamanism and molecular biology. In the book, The Cosmic Serpent, I presented the hypothesis that shamans take their consciousness down to the molecular level and gain access in their visions to information related to DNA, which they call animate essence or spirits. So that's the thing, you know, these shamans down there, these traditional healers all over the world, you know, they're talking about spirits and energies in people and trying to clear those spirits and clear those energies. And that those ideas have been so far away from anything in Western medicine that there really hasn't been much to talk about, you know, between the shamans and doctors. But he saw this experience where he saw there's something going on there at the DNA level. So that's kind of what one of the big theories that I put forth in the book, The Fellowship of the River, is about that. And it's a presentation of these ideas, which I say is the intersection between biology, emotion, and spirituality. You know, these different fields that I'm saying, now we know enough science that we can start talking about how these things are bridged. So, you know, in the talk I'm going to bring up, as much, depending on the time, a few cases that I present in the book. Now, like I mentioned, migraine headache, PTSD, post-traumatic stress disorder. In this case, from a Vietnam vet, somebody who's been through a lot of war trauma, is traumatized psychologically. Idiopathic chronic cough, somebody who has got a chronic cough that's just not going away. They've been to all the doctors, nothing's working. Dry cough, Crohn's disease, which is a form of inflammatory bowel disease, right? Crohn's disease, like, you know, there's different stages of there's ulcerative colitis, there's Crohn's disease. Some people just have maybe a touch of irritable bowel syndrome, these weird intestinal disorders. And then those four, for example, all of these four responded to this plant medicine treatment that we were doing down there that involves this traditional Shipibo approach with this dietary changes and kind of lifestyle restrictions, and also this regular treatment with plant medicine, and in addition to that, ayahuasca ceremony, okay, and treatment by shamans. So I'm saying all these four cases that look so different, four, you know, particular cases that I present in the book, they all improved. And I said, you know, for the doctor, for me, I'm a family physician, trained here, and I went to UCLA Family Medicine here in LA, and went to medical school at UCSD. You know, if you have migraines, you end up sending somebody to the neurologist. You got PTSD, they end up going to see the psychiatrist. You know, this idiopathic chronic cough, she'd spent some time with the pulmonologist, getting all this pulmonary testing, all this stuff. Crohn's disease is in gastroenterology, he's getting colonoscopies. You know, they're doing all that kind of stuff. So very separated kind of ideas about what's wrong with these people. Yet these four cases, it's apparently so different to a Western medical approach, all improved with this kind of shamanic approach. So then I'm saying, what physiology links these problems? They must have something in common. What commonalities make such problems potential targets for traditional Amazonian plant medicine and ayahuasca shamanism? So in the cases I present, the healing that happened for these people, what shifted inside them that allowed them to heal was it was emotional trauma was underlying each one of these problems. And so in each case, the problem involved dysfunction in the emotional body. So I'm saying there is an emotional body. We're now ready in a scientific world to talk about the presence of an emotional body that has already been described in traditional Chinese medicine or Ayurvedic medicine or other kind of metaphysical approaches. They talk about the presence of an emotional body, but, you know, Western doctors, we just have been uncomfortable talking about that. So where is emotional trauma stored in the body? And how does this contribute to associated physical symptoms like migraine headaches, like inflammation in the bowel, like chronic cough, and like a diffuse problem like PTSD? How does emotional healing inspired by spiritually oriented techniques, you know, ayahuasca shamanism, singing songs to these people, mystical songs, help to alleviate such problems and then lead to these physical changes? So PTSD, so this recent conference, the MAPS conference, post-traumatic stress disorder is a big focus of psychedelic medicine right now. MAPS.org, because they're having so much success. Okay, like this MDMA, what they call Molly or ecstasy, is now a part of a protocol, MDMA-assisted psychotherapy, that they're using to treat PTSD. And they're now running through these clinical trials that MAPS is putting on, this foundation, that are now at like the final stage of FDA approval. So they're about to approve a psychedelic medicine for the treatment of PTSD, and they're treating, they started with, I think, some sexual abuse victims and that kind of, and then now they're, you know, the Pentagon is interested. They're interested in trying to help people through war trauma. They're dealing with police. They're dealing with firefighters. So very conservative elements of our society are getting help from what used to be considered, a really wild approach, giving them a psychedelic medicine or, what people call ecstasy. But it's done in a very set protocol, this MDMA-assisted psychotherapy, and they're getting great results. So PTSD is also something people are interested with the ayahuasca, because a lot of vets have gone down to the jungle and they've had improvements, significant improvements. And these are people, like the case I bring up in the book, Russ, is a Vietnam vet. So that's 4 decades or however long ago it was. He came back, I think, in the early 70s from Vietnam. So like I said, when you're at the VA and you go to the group therapy session for PTSD, and you're coming back from Iraq or you're coming back from Afghanistan, and you're looking across the room at a 70-year-old man, and you're thinking, oh my God, I'm going to have this for the rest of my life. That's the current situation. That's what we've been able to achieve. And there's been a lot of failed treatments in PTSD. So it's a really big deal that MDMA is making a difference, and it's a big deal that ayahuasca healing and these kind of approaches are making a big difference for these people. And I'm saying that, what was it that happened for Russ down there in the Amazon that allowed him to get over these symptoms that he was suffering from with his PTSD? And I'm saying, well, there are a lot of wild spiritual things happened to him, but something simpler that we can talk about, he went through a profound emotional healing process. Like, that's something he would definitely describe himself. And so that healing allowed him now to cope with stress in a new way that he hadn't been able to do in a long time, both psychologically and physically. His blood pressure went down, his hypertension improved, his, reaction to what's going on around him slowed down from this emotional healing. So I'm saying this healing occurred in his emotional body. And so what is the emotional body? Well, first it's the medium, through which we experience emotion and feeling. It's that, subjectively, it's where we experience emotion and feeling. But then physically, I'm saying it's the physical apparatus connected to that experience of emotional feeling that I'm saying now that we can describe. And what I talk about in the book is that it is this psychoneuroendocrine immunologic network, which basically mind-body medicine research, like here at UCLA, at UCSD, mind-body medicine research has been going on for a long time now, as they try to study how stress affects illness. Why are people who are more stressed out get sick more often? Why are people who are more stressed out have more problems with inflammation? Why are people who are more stressed out have a harder time healing wounds and broken bones and things like that? So there's a lot of research that's gone into that, and now they've really studied that network of the relationship between your psychology and what's going on in your mind and your body. And so the connection points that are, the most obvious one is your brain, but then also the way that connects into the autonomic nervous system, the one that controls all your automatic functions, your digestion, your breathing, your heart rate, your blood pressure, etc., your sweating. And that's also linked in to parts of your endocrine system, your hormone system, how much cortisol level you're producing, how much adrenaline you're producing, other hormonal disturbances that are out there, and your immune system, how much inflammation is being produced in your body, And so that network and the way it's connected in, here we are in a chiropractic clinic where he's definitely addressing like the nervous connection to so many, different symptoms and aspects of our body, but now following that all the way through to where it's connected to your brain and the emotional processing center of your brain, the limbic system and parts of the brain connected to that, and then all the way out to the way it affects your immune system and white blood cells and different parts of your hormonal system. So that's the PNI network, okay, psychoneuroendocrine immunologic network, which I'm saying is the emotional body. So I just described how it's the limbic brain and the paralimbic structures, the autonomic nervous system, elements of the immune system, the endocrine system. So a classic example of a central piece of that is this stress response system. That's a big focus of mind-body medicine and mind-body research. The stress response system is this HPA, hypothalamic pituitary adrenal axis. This HPA axis is this axis that is basically the fight or flight response system. Okay, within your body. The fight or flight response system is one way to think about it, and the way it's going to cause your nerves to react and the way it's going to affect cortisol levels and adrenaline levels in your body. So that, I'm saying, is part of your emotional body. This fight or flight stress response system is part of your emotional body. And that is a part that's screwed up in people with PTSD. Okay? And when they heal and when they have decreased symptoms, the physical functioning of that system improves. So we can show that's an area of the body where you could study how emotional healing changes physical function and how emotional trauma changes physical function. People with severe emotional trauma, a lot of them have disturbances in their stress response system in the PNI network. and it's a documented thing. So just to give an example, PTSD and the emotional body. So PTSD, deep-seated emotional trauma, lurks within and disturbs multiple elements of this emotional body, the PNI network, causing overwhelming fear and anxiety psychologically, overactive fight or flight response in the nervous system, abnormal adrenaline, cortisol levels in the hormonal and endocrine system, and out of control inflammation in the immune system. So that's where you can see that multiple parts of this emotional body are disturbed in somebody who's got a problem with their emotional body, like PTSD. So emotional healing through shamanic techniques and otherwise heals PTSD in part by improving the function of the HPA axis, the stress response system, and other elements of the emotional body. So I just have some references for the YouTubers. They can pause. So migraine headache. So a different case. This woman, Lisa, is described in the book. She came in her early 30s, suffering with these really bad headaches. And worse with her menstrual cycle. They're so bad, she can't work, she can't do anything. You know, when she gets her bad migraines, it's pretty regular. She takes sumatriptan medication. She needs to take it every month to handle it, but that's just to get by. You know, she can't work still. She just at least can survive the pain of her headaches. She came down. She's been suffering with that most of her life. She had a 10-day treatment down at the center at Niue Rao with plant medicine and ayahuasca and shamanic treatment and ceremony. And she had a resolution of her headache problems, you know, that lasted well, you know, into a year before she had a really significant headache. So that was a major change in her physical symptoms and her experience of life from this thing. And, you know, she's been going to the doctor for her whole life, you know, so 10 days had this huge shift. So during this year, she also had, you know, continued psychological support. So that's one of the big things that is coming up with this topic of people going down to the Amazon or getting that kind of treatment or psychedelic treatments. She did have support when she came back. She did have people helping her through the integration of what she experienced down there. And that was a big part of what helped her progress and stay healthy after she came back. 2 years later, she decided to come back. She had further improvement. She was having difficulties with her menstruation and cramps, and that got better. So in ceremony, you know, what happened to her? Well, a lot of different things happened to her, you know, but one of the things that came up and in talking to her and kind of, like I said, where you're in a retreat, where you're living with the patients, something I had seen with some other migraine patients, and I'm not saying every migraine patient is this case, is like this, but a few of them had described like being exposed to a lot of screaming and yelling as a child, you know, and in her case, there was a lot of aggression around her as a child growing up. Her dad was a very kind of rageful individual, throwing things around, screaming, you know, when she was a very young child, and just feeling very overwhelmed in her senses by that kind of exposure. And the kind of the erratic, he was also very loving at times, you know, so the confusion of sometimes he's just the best and other times he's so difficult and even very derogatory towards her and making her feel terrible about herself. And so there was a lot of like shedding in the ceremonies of energies associated with that trauma. That's what she felt. And then her ultimate healing was like a deeper spiritual process which involved forgiving her dad and understanding where he was coming from, you know, and learning to accept, like, this is who he is. I don't need to take that on myself personally, but going through that at a very deep kind of spiritual and emotional level. And you know, some other strange things we don't have time to get into, but you know, that's described a little further in the book, and that is kind of what she attributes to her healing and the improvement of her migraines to, is that process, and facilitated by this kind of mystical experience with the ayahuasca ceremony. One time, you know, you know, the book describes a little bit of my training and going into and learning about this process of ayahuasca shamanism, this particular Shipibo tradition, where you're training to help people through song. In the ayahuasca ceremony, I'm drinking ayahuasca with them, you know, to have visions and then to sing about what I'm seeing in them and try to help clear and clean energies through song that I see in them. So there was one night that I was trying to help her, and the ayahuasca showed me this vision. I had this vision of her DNA, you know, of her DNA, but it was wrapped up in the proteins. The DNA gets packaged in these proteins so that this long DNA can be packaged in the little cells, you know. It needs to be packaged up very tightly. It's like kind of a real magical geometry that goes into fitting that all in this functional way. And so I saw this DNA packaging, we call it chromatin, like what makes up the chromosomes, and you know, in medicine as it's described. I saw it, and then in all the nooks and crannies and the little channels between the molecules, there was this little black dragon swimming in the channels. And the ayahuasca told me in some way, her problem is not in her genes, her problem is on top of her genes. There's this little dark program swimming on top of her genes. And it's not that it's in her code and that she's destined to have migraines. There's a software problem, not a hardware problem, and it's off. And it needs to be cleaned and cleared, and then she can improve. And so my friend Marcus Drossel, who did the cover art for the book, is working on a version of that. You know, he's making this, it's still in the works, but this is where he's at right now with it, of this idea of this dragon swimming on top of the genes, and that it's this concept of like the epigenetics. So you have the genetics and then you have the epigenetics, that which lies on top of the genes, the epigenetics. Just like you have the dermis and then you have the epidermis in your skin. So the epigenetics, which is over the surface, is the kind of the biochemical machinery that's covering the genes and the code, and it's kind of some Bruce Lipton, a guy who writes books on this topic, talks about it as like the contractor that's reading the code. You've got the code, but then you've got a contractor that has to read that blueprint and decide what genes are going to be expressed, which genes are going to be turned on and off in response to the environment. And so it's actually very influenced by the environment. And within the lifespan, there's a lot of ways that those genes can be expressed. So you see things like where identical twins, you know, they have variation between them. You know, that's an epigenetic phenomenon. They have the same DNA code, but their genes are being expressed differently. And you see there's many levels of that. You have different cells. I got cells, red blood cell that has the same DNA code as the cell that makes up my, part of one of my spinal bones. Okay, so it's the same DNA code, but they're programmed differently to express the genes differently. So there's a lot of room for variation there. So, like I told you, Jeremy Narby said, shamans take their consciousness down to the molecular level and gain access in their visions to information related to DNA, which they call animate essences or spirits, like this little black dragon, that somehow they can see into that level and then try to help shift things at that level. And that's maybe part of the magic of shamanism and the magic of spiritual healing, not just shamanism, ayahuasca, but perhaps maybe this is how spiritual processes like forgiveness, and spiritual energies like gratitude and love and compassion, like how they influence our biochemistry. Because there is evidence and there is research into those topics. How is it that gratitude is improving people's health? Where does that happen? And so there's reason to believe maybe it's happening at the epigenetic level, and that's my theory. So this epigenetic software, so you could see that's the blue is the proteins, and the DNA code is wrapped around these proteins, and then it makes up this chromatin, it makes up these chromosomes. But along those little segments, there's a lot of areas where you can have these little tags, these little places to imprint, the outside, not the code. You don't have to change the code, but you can imprint around the code, and it's going to affect the way those genes are expressed. So that's one example of epigenetics. So if you see, you can't read it, but they're saying epigenetic mechanisms, things that we know that affect epigenetics, development, in utero, in your womb, childhood, environmental things, chemicals, drugs, pharmaceuticals, aging, diet, nutrition, all those things are known to affect epigenetics. What are the diseases that they're looking at in relationship to epigenetics that people are saying, oh, it looks like epigenetics may be a huge factor in cancer, in diabetes, in autoimmune disease, in mental health. So as I mentioned, in the visions, these energies appeared to me as little black dragon. In the physical dimension, these energies manifest as stress-related damage in the stress response system and the larger PNI network, this psychoneuroendocrine immunologic network, the emotional body. These disturbances in the emotional body can generate psychosomatic symptoms through processes like neurogenic inflammation. In other words, if you've got some kind of emotional trauma imprint that's altering the function of your emotional body, let's say the stress response system or some other part of your emotional body, that can actually cause certain parts of your nervous system to generate inflammation in some part of your body where there's no insult. Nothing's attacking you, you didn't injure yourself, there's no bacteria. It's kind of like the autoimmune type of inflammation. So for example, migraines are being looked at like, hey, you know what, we know there's something wrong with the blood vessels in their brain. We know there's some kind of reactivity going on there, and it's looking like it's a form of neurogenic inflammation. So the nerves are causing inflammation in that part of their brain, and it seems to be connected to and in response to emotional disturbances like that go all the way back to the limbic system in their brain and other parts, the imprints throughout. So curiously enough, such inflammation can improve with emotional and spiritual healing. So that's a physical process, it's neurogenic inflammation that is being linked to emotional trauma, that then emotional healing and spiritual healing processes can actually lead to decreased neurogenic inflammation. So I just mentioned that migraines, but it's not just migraines, all those cases I just brought up, the cases I bring up in the book, idiopathic chronic cough, this lady's chronic cough turned out it was like a neurogenic inflammatory process linked to a lot of emotional things going on, and once you work those things out, it went away. Psoriasis, we know that there's neurogenic inflammation involved in some degree of like some of the skin disorders, including psoriasis. There's genetic things, there's dietary things, there's allergic things that are factoring in, but there's also emotional component that we know stress increases flares of that. And this is the mechanism, this neurogenic inflammation. Crohn's disease as well. Crohn's disease is inflammatory bowel disease. Crohn's disease, they're trying to do all this stuff. They're using all these steroids and different kind of medicines to calm down the inflammation that is going on in their system. But what is underneath this smoldering neurogenic inflammation? So neurogenic inflammation is inflammation generated by the emotional body, in many cases part of a maladaptive stress response related to the body's ongoing struggle to deal with unresolved emotional trauma. So current research supports the idea that energies of childhood trauma, for example, so when you talk about issues that people are carrying from childhood onward that are affecting the rest of their lives, that occurred perhaps in a key period of emotional development of the human being, that now there's evidence that we can see that there's imprints in their epigenome, that their epigenetics was imprinted and altered during that time, and it stays with them. It's a software imprint that stays with them throughout the course of their life until some kind of intervention can change that. And so in monkey and human studies, the biological memory of childhood maltreatment has been linked to epigenetic imprints. In monkeys, these lasting epigenetic imprints can be detected later in life in cells and tissues of the emotional body. When they look at limbic brain, they look at some immune cells, they can still see these imprints that were placed back then. This is just a little reference. So unresolved, and then, that's coming up, I'm not getting into it so much in this talk, but that's a big topic right now in the news and stuff, is epigenetic imprints from ancestral trauma. The way that Holocaust survivors, children, are infected by the trauma they experienced, in the concentration camps. And now there's evidence to show that that's epigenetic, that it is real. There is ancestral trauma, there is intergenerational trauma that affects us, and you can show it with animals. They can stress these animals out and watch how their offspring are continued, they maintain a stress response to a certain smell that the grandparent was conditioned to be stressed out by. So unresolved emotional issues hang on in the emotional body as what in Shipibo terms would be described unhealthy energies. Shamanically, we need to clean out the spirits or the energies associated with Lisa's father's anger, her psychological trauma, her own anger. And so this is Ricardo Amaringo, the shaman that I work with and I trained and studied with. And so that's, that is the focus of a lot of the shamanic healing that goes on in the ceremony. He's going to say, we need to clean out the energy, the dark energy, the difficult energy, the problematic energy from her ancestors or from her parents or from her experiences in her womb, in the mother's womb, or in infancy, childhood, adolescence, adult life, from where they lived, from their relationships, maybe even from other mysterious sources. But, where do all the stories of these kind of problems live? Well, each one of these things is now a focus of epigenetic research. The way your in utero experience affects the rest of your life, epigenetic research is looking into the way you get imprinted by, let's say, your mom was very stressed out during the pregnancy, or things were great for her during the pregnancy, or, things that happened when you were a childhood, or more obvious stuff like the way some chemicals, some pesticides in your community were affecting your epigenetics. So some more references there. So, epigenetics, it's really being looked at in terms of environmental and nutritional toxicity. When you look at cancer, when you look at diabetes, when you look at neurodegeneration like Alzheimer's and Parkinson's, and why are things cropping up more and more? People are curious about autism and epidemics of autism, and what is that about? So epigenetics, people are looking at the way all these things, whether, some people are worried about vaccines, other people are worried about Roundup, other people are worried about other carcinogens and other things in the environment that are altering the way people are developing. But similarly, emotional toxicity, okay, seems to be affecting epigenetics and leading to problems like depression, addiction, anxiety, PTSD, which are what I'm saying are problems in the emotional body, and they're also epidemics that we're suffering from in this society. You know, there's more anxiety, there's more depression. So there's some kind of emotional toxicity going on as well that other parts of the world are not experiencing in the same way that we are here. You know, so it's a cultural issue. So epigenetics is very relevant to cultural health problems stemming from our relationship to the environment and also our lifestyle, diet, but furthermore, our family and social relationships really affect our genetic expression. So I'm just going to touch on briefly this other case, and then I'd like to open it up to questions. But it's another case presented as just Crohn's disease. So this guy's got Crohn's disease for 2 decades, had multiple surgeries, you know, over that period of time, suffered serious complications, needed a colostomy for a while, but also simultaneously had been suffering with a lot of severe depression and suicidality. Showed up very suicidal, very depressed to the center. And then just a little description of Crohn's disease. Just it's an inflammatory bowel disease. I'm saying there's neurogenic inflammation known to occur in Crohn's disease, and these people have this really severe abdominal pain and diarrhea and fatigue, weight loss, and we know that there's environmental factors. We know there's dietary factors. We know that gut flora plays a role, and there's some genetic susceptibility. But then, you know, there are those people that get better and those people that get worse. And so we have to look at the fine-tuning of those factors. Psychological problems like anxiety and depression are common in inflammatory bowel disease. A lot of times they don't get looked at enough. When people have Crohn's, when people have ulcerative colitis and these kind of neurogenic inflammatory diseases, you know, it's not uncommon to see anxiety and depression. There's research to support that it's common, in fact, that these people have emotional trauma like in their lives. It's theorized that it's due to the stress psyche's influence on the brain-gut axis, on the HPA axis, the stress response system, and their autonomic nervous system. Crohn's disease involves disturbances in multiple regions of the emotional body, the PNI network. As with psoriasis and migraine headaches, intestinal inflammation in Crohn's has been linked to emotional body dysfunction and neurogenic inflammation. So multiple lines of evidence, by the way, also indicate that epigenetic disturbances play a significant role in the development of Crohn's disease. So now we see how Crohn's disease is looking like this emotional body problem. We know that it has these psychiatric comorbidities, that it's not uncommon to see anxiety and depression in these cases, and that we could maybe look for emotional trauma. Maybe it's not the whole story, but it might be worth looking at somebody who's not getting better when they're doing everything else and they're still not getting better. It might be worth looking. And then now we have research to show that it's, you know, linked to some epigenetic changes that have gone on over the course of their life. And so his ceremonial treatment, you know, involved overcoming extremely physically abusive childhood, you know, a lot of abandonment issues, then like a repressed sexual abuse scenario that came up in the ceremony and then was investigated when he got home and verified and worked out. And, you know, then of course in his like improved mental health, when he was feeling better about everything and working through all that stuff, you know, he improved his diet, and that helped a great deal. You know, his diet was really bad. But he had this deep spiritual, mystical experience. In his case, involved all kinds of things in the ceremony, you know, that are a little out there for people, but he's just being honest about what he experienced. He felt like extraterrestrial, hyperdimensional beings were reprogramming, you know, his brain and his body, and a lot of, you know, purging, and then ultimately realizing these things and making peace with his stepdad and figuring out what to do about the sexual abuse and working out those issues. And then you see like a major shift. This is just some research on Crohn's. You see a major shift in his symptoms. You know, you go a year, no symptoms. Shows up on his way to us, diarrhea 14 times a day, severe abdominal pain, and then he has this humongous change with no medication, does a little medicinal marijuana when he feels a little disturbed. Then he had a little flare when he was going through the divorce proceedings and custody battle, you know, like high stress situation. So reasonable. How does shamanic medicine interact with the physical body? How can songs and forgiveness dampen neurogenic inflammation? How can plants and rituals affect the physical realms of the brain, nerves, immune system, and hormones? I'd suggest that in part it's through the healing of maladaptive epigenetic programming. And that's one of the theories that's presented in the book, like I said, that's mixed into a lot of stories. And we have a lot of reason to believe that healing epigenetics is very valuable in mental health and in emotional health. There's research to show that antidepressants help epigenetic, issues, that meditation can alter the epigenetics, alter states of consciousness, that psychotherapy works by altering epigenetics, and so then it's only natural, I would suggest, that shamanic healing does the same. There's a few more references, and that's it. And Modern Spirit is an organization I started with my brother that is just in its beginnings, but we hope to be kind of teaching and sharing these kind of ideas with healthcare professionals to try to demonstrate the value of spiritual healing in modern healthcare. We know that we can accept that physical healing is so important, whether it's through pharmaceuticals or, through surgery and things like that. But, if we can do, affect the body in a more holistic way through chiropractic, but then sometimes, also spiritual approaches that are going to reach people at a deep emotional level that a lot of times other approaches don't touch, And sometimes psychedelic medicines can help open people up to that when they have a hard time going there. So that's what I wanted to say, and then maybe we can do some questions for a little while, if that's all right.
So when you're talking about the DNA and how it has those tags on it, are you saying that the tags get broken off, or like what happens?
Yeah, somehow they change. So we know how. So when they study those. And that's one example of the way that the epigenetics could be imprinted, those tags. So when they study and it's not everywhere, but certain parts of the body, like with these monkey studies, they're looking at the way DNA methylation, that's one of the tagging biochemistry, processes, how it affects, and these prefrontal cortex cells are parts of their brain that are linked, they interact with the limbic system, the emotional system, and T cells, white blood cells. And they look at these two distinct parts of the body and they're tagged the same, and it's the tagging that happened during, like I said, signature of maternal rearing. It was a signature of, they were comparing one group of monkeys that was left with their mom, had a nice, happy, monkey upbringing, and then the other one that was taken away from their mother. And they can show the difference there. Okay, you can see the imprinting difference there. So how does it happen in the first place? It's kind of mysterious. In other words, that's part of what the book is exploring. When people talk about these energies and shamanic energies and, with all this kind of immaterial stuff, that's a little confusing to people who want to have like a material explanation for everything that happens. But emotion kind of already crosses that barrier and it's part of our everyday life. In other words, we know that we have emotional exchanges with people that leave us affected. Energetically, it's every day, all day. It's part of being a human being. And so that's not so woo-woo, that's just honesty. It's an honesty that medicine and science has been shying away from. But it's like over the phone, was there some pheromone coming across the phone? Like what happened biochemically to make something shift in the way my heart is acting and the way, in reaction to somebody's voice? And that repeated emotional trauma and stress of some kind, which may not involve any physical contact, would lead to imprints in the system. So we don't know, how do those tags form in response to those emotional experiences, or why do those tags form in response to the absence of a mom, for a monkey. So the idea is that initially that kind of biochemistry would be starting up to try to prepare for that stress. Like in other words, the first part of the reaction to stress, it's an attempt to adapt to the stress. So too much of this, okay, we're going to dampen it, we're going to scar it over, we're going to block, we're going to toughen up that side. But then it gets overly done, and then it never gets undone, and it starts to build up. And the stress, wear, and tear starts to build up. So the first tags are probably some kind of a response to, okay, we need to change the way we respond to stress. The stress is overwhelming. Let's change the way the system is responding to stress. Day 5 of lonely monkey life, baby life. Day 5, okay, we're just going to toughen up. We're just going to, it's no big deal. The mom's not around. We're crying. No one's coming. Just do that. But then it keeps happening. And it keeps happening. And it keeps happening. And it builds up. And then you get into what we call maladaptive stress response. Now you've kind of recalibrated yourself over here, and it doesn't work that well. The body doesn't work that well. So PTSD is an example of that. We have recurrent stress. You're trying to respond to the stress. Okay, your body is trying to react to the stress, but then it never comes back down. and then another stress comes, and then another stress comes, and it never comes back down. So there's the imprinting and the tagging is related somehow to the physiology of that there is an initial attempt just to react and respond in a way that's going to be productive. But then because of the nature of the stress, it becomes unproductive over time, say maladaptive. So then the untagging of that is like the unwinding of that also, you know, is we don't know how. Like, in other words, this is one of the examples that I bring up when people, they want to like ignore that these emotional interactions, which are kind of an energetic interaction, are affecting physiology. But then we now have research that meditation, you know, that people in these really advanced states of meditation, they check their blood before and after in the same day, and they're showing that their epigenetics is changing from just that. So how does that happen? You know, and so people are, oh, you know, they try to describe how it happens, and we don't really know. But I'm just saying, it seems like the epigenetics is one of the places where it kind of dead ends when they try to find out, like, where is this coming from? Where is it happening? And they follow it all the way down to see the way the genes are being expressed, and then boom, that's the last stop on the biochemical like trail. So it makes me raise the question, and maybe it's wrong, but it's just an idea, that it seems like the epigenetics is like sensitive to the energies. You know, like there's evidence that suggests that. Which would make sense that some part of our physical body is sensitive to things like that. You know, because people experience that all the time, you know. And the reason people have been in science is trying to deny it all the time is because because we can't prove it, you know. As yet. But then this is what I'm saying is like, you know, what's curious to me is that like the antidepressants are showing that, we know that they have direct, like, monoamine oxidase inhibitors, like the ayahuasca vine. We know that they have like a direct effect on those imprints and tags. These histone acetylase, like the way those histone proteins, which are part of those balls, that they get tagged, we know that actually directly does that. So there's biochemical ways that happens that we can prove, and antidepressants, some of them are known to do that. But then meditation is doing it, psychotherapy is doing it, you know, people are just talking and giving loving support over a period of months or years or whatever it is, and you're seeing those tags change. And so how do you explain that one, you know? And so it's like, well, you know, people say, well, it's responding to love, you know? And so that's why I'm like really into bringing this topic up and just talking about this intersection between biology, emotion, and spirituality. Because if, like, we're dealing with this crisis of depression, addiction, anxiety, you know, in our society, which we are, which the current model, you know, the biomedical model and its approach to these problems has been kind of not working too well, you know. Addiction is like, they're throwing a lot of money at addiction, a lot of money is getting thrown at anxiety, a lot of money in depression, a lot of money on PTSD, massive amounts, and they're not making a lot of progress. Yeah. So then it calls for, like, we might need to change the paradigm a little bit, because the current paradigm, approaching it from a purely materialistic, and you might say inhuman, you know, in other words, we're not going to talk about the emotional side of this because it doesn't make sense to us, is really like the nature of the problem of our society from a healthcare perspective. In other words, because now I'm going to do that to myself. Now I'm going to deny that I have emotional experiences because it doesn't fit into like the politically correct or whatever it is, you know, at least as a doctor. In that, you know, I think the people are not, you know, blind to that. But in these, like, you know, in the world of books and things like that, you're not hearing enough about that. You know, and that's maybe why some of these problems aren't getting better. And once you address these problems and start talking about people's hearts and souls in a way that moves them, then you have a chance to turn somebody around. And so my thing is, I'm not talking about this just to be new age or just think that it's cool to talk about this. It's like, I'm talking about people not getting better. You know, I'm talking about everybody has a family or a friend or somebody that's suffering with this problem. And if it's a cultural problem, if our culture is looking at our health in a way that's neglecting the emotional and spiritual dimensions of health, then wow, we're really like, we're wasting a lot of money. You know, precious healthcare resources are lost because they're missing the boat. That like, hey, you know what? These guys' problems were of an emotional origin, and they needed to be addressed that way. Yeah.
Do you think, because we use neurolinguistic programming to reprogram the subconscious,
Right.
and we also use proprioception to change that,
Right.
do you think the ayahuasca's doing a chemical programming, or do you think it's
There's a chemical programming, so that's being studied like at the chemical level, and that yes, it has like independent chemical properties, and that you can see changes in like neuroplasticity and neurogenesis, new nerve cells and stuff from just the ayahuasca on cell culture, that's being studied. But, I guess what I'm very curious about is the way that same, like chemical reality of emotion, the emotional experience, is also linked to like moments of inspiration. In other words, people are having an experience, a mystical experience, which they find extremely meaningful, and they also feel all those chemicals in their body. It's kind of like when people say, love is just a chemical reaction. They already figured it out. I can give you this chemical and you're going to think you're in love with that person. Okay, but then still somebody's having that experience completely independent of any chemistry or any laboratory, and their sense of that is very different from what you might try to convince them of. So that's my thing, is like the spiritual side of it. In other words, that what gives people meaning in their life? What is it that people consider to be spiritually significant in their life? In other words, their sense of purpose. And so turns out that's mixed up with your emotional chemistry as well. Because a lot of people come down to the center asking for, help me find my purpose. Help me find my passion, my true meaning, what moves. I don't know why I'm here. I don't know what I'm into. I don't know what I'm passionate about. The Shipibo, the traditional Amazonians' approach to that is that the reason you don't know that is because your system is blocked. And so we need to do like an emotional cleansing process on you so that now you'll feel more clearly, and that will guide you. And that's gonna like help at a higher level, like at this meta level, your sense of what's going on around you and your sense of how you feel about that is gonna fuel your intuition and your guidance and your sense of purpose and meaning in life. And so there's that side of the emotional world that is entering research now. Like the secular world is curious about what it is that some people who feel like they have a sense of purpose and meaning in life, their immune systems are performing better than people that don't. I talk about that research in my book, this personal mastery scale. When they do like Alzheimer caregiver burnout, when people are taking care of somebody with Alzheimer's, there's this caregiver burnout syndrome where they just can't take it anymore, it drives them crazy. Some of them handle it pretty well. Some of them don't mind taking care of an Alzheimer patient, And turns out there's cultural reasons for that, and there's other reasons for that. But one of them is that they have this kind of like spiritual thing going on inside them, and they don't mind, And so I guess I totally agree, and it's nice to hear, and you guys are definitely more aware and connected to that, of like just the chemical reality of the emotions and the way that our body is linked physically to the experience of emotion. But then the book touches on this like other thing, that the emotion is also just like mind-body is linked, and that's kind of, everyone talks about mind-body in the scientific world. But a lot of the traditional kind of metaphysical, like Chinese medicine or Ayurveda, they talk about emotion, energy body linked. So that now this emotional body also is linked to the mystical. In other words, things that we experience that are beyond the comprehension of our mind. That again, we can deny that these things happen to us, but it's a very common experience to have something mysterious happen to you. Something that doesn't make a lot of sense. When somebody's staring at you on the freeway at 80 miles an hour, they don't have a good explanation for that. But it's very commonly experienced. People pick up the phone, they know who's going to call, it happens. A lot of things happen. And so those things have been kind of rejected from the scientific discussion for a long time. But again, it's back to this denial that's at the heart of what's kind of eating away at our healthcare system. I'm a doctor, I go to medical school, I got depressed going to medical school. Turns out a very large percentage of medical students are depressed. Suicide, the current was 30% was what I saw. 30, I wasn't depressed before that, actually. Like in my case, I had a pretty happy life, whatever. Maybe wasn't stressed enough. Other people were tougher by the time they got there and they were able to handle it better. Maybe that's my problem. But still, it was there that I really felt confused, and I felt like they were asking me to deny all kinds of parts of myself and my experience and about the patients that I'm talking to. And there was no, and I get the part where it's like I bring up a lot of times that, yeah, it's really intense, and we can't, because the, chiropractor and the other different healthcare providers, it's a little bit different of an experience in the sense that when you're training in the hospital, and you're watching people die and suffer a grave illness a lot, yeah, you callous up, that's part of it. And so we can't, we need to have some compassion for these guys and these women, that are just trying to survive that kind of process and that experience on a regular basis, at a young age. And so then so my thing is like, let's not just attack them because I'm one of them, but let's, come in and fill up the gaps, and get them to calm their arrogance and say, we need some help filling these gaps. It's not enough to tell somebody, hey, you have a herniated disc, whatever, you need surgery, that's it, closed case. Instead of saying, oh, I know this great chiropractor, maybe you should check them out. Or any number of problems that you treat here. But same thing, it's like, oh, you have chronic depression, that's a lifelong problem, you have a chemical imbalance, your kids are gonna have it too. And then you charge somebody for that, You can charge somebody for talking to them like that, which is kind of a disappointing experience, for both parties involved actually. But it's an economy, it's a functioning economy,
That's cool. So like a chemical and an energy rewiring.
Yeah.
I like that. That's cool.
Yeah, exactly. Trying to bring the energy into the discussion a little bit, just for the sake of the shamanism.
What is the effects? How long are the effects from the ayahuasca compared to, just doing meditation and
right.
Other modalities?
So that's the big question, you know what I mean? And that's what's kind of like, that's where we are now. So everyone, people have been going down very excited, like, hey, this is amazing. And then like, okay, some people it's lasting a really long time. Some people it's fading away. And so that's what is being investigated right now. Like these cases that I presented in the book, like Russ, he's PTSD, Vietnam vet, he came down, and the first time we went down was 2009. So now we're getting into like a decade later, almost whatever, 8 years later, he's doing great. But Russ, like when he got back, he was motivated to, like he says, I wasn't ready for therapy before ayahuasca. Afterwards, I was. So then he went to this integrative medicine program that the VA was putting on at the VA, where they had Native American ceremony in Arizona and all that kind of stuff. And that really was like, he liked that. And other group therapy. And he started like helping out with the guys coming back from Iraq and from Afghanistan. So he had like an integration process. So there's kind of a recognition that you need some kind of integration process. So that ayahuasca and other psychedelic medicines, that there may be, like I tell people, I think there is a degree of stuff that may just be cleared, and there's evidence, there's cases, anecdotes about that. People just have their shift, it's gone, Then there's some part of it that's like transformational, that like that problem, that issue is now like a window into new compassion and a new understanding that helps you deal with life and helps you deal with other people. And then there's that part that maybe still haunts you, but you've learned how to get out of it when it comes around, And so that's what I can say about it. And then like, the other case, the migraine case that I presented, she's doing great. It's been several years. She also followed up with like this life coach who had been to ayahuasca and his experience and was an AA counselor for like 20 years. So he has a lot of experience. Then this other guy, he's following up with anybody. The Crohn's disease guy is a train engineer from Canada, but he's trying to take care of himself. He's working out things with his family. You know what I mean? Like he's doing his ayahuasca homework, like we say. They said, you better solve this issue with your stepdad. So he's out there, he's doing that work. And he's figuring things out about, what happened with this sexual abuse history. The other cases I talk about, an addiction case where the guy was down there doing cocaine all the way to the airplane, has a huge healing. Oh my God, I'm fixed. Unbelievable. 9 months later, writing me, this is amazing. This is incredible. Then goes back to the work environment that he used to be in, where he had a big problem, and starts drinking, and then starts doing cocaine, and now he's back. So then he came back to the jungle again. He says he still feels like he honestly, his report is that he just never sank as low as he did before. And he feels like there's a real difference every time. But he ended up coming back 3 times, each time relapsing, but each time less, you know, and having prolonged sobriety. And now he's in AA with a group of people that once in a while drink ayahuasca. So, you know, it's just like I couldn't say, and they're doing research. It's just starting now, the research. The first research is just like, because it's pretty new. So like, okay, well, this happened 6 months ago. That's what we can say. But like 5 years, we don't know. What we could say is we could cause it is possible in some cases to create a huge shift and a new opportunity, you know, to heal. But that, yeah, there's more work to do. And so we wouldn't say that it's like a panacea, it's not the answer to everything. And for some people, it's just a temporary shift and they don't change anything in their life. And so nothing changes. You know, it doesn't last.
They have to want it.
They have to want it. And that's the thing about traditional medicine. And that's what we struggle with, you know, in our medical system, is that because of the nature of the coverage, you know, everyone's like paying in either through their employer or through something. And so they feel like their work is already done because they paid their bill. So they show up, fix me, you know. If they come here, you know, it's okay. You know, they probably have some insurance coverage here, but it takes a little more effort, you know, to get involved in this kind of care than just showing up and complaining that you guys aren't doing anything, you know, give me a new pill, blah, blah, blah. So that's a very frustrating situation too for the healthcare provider. As a family medicine doctor, you know, you can tell the family, oh, I can't believe you guys are so jaded and so burnt out. Why don't you go work in the clinic for 2 weeks with the American population and see like how motivated, you know, and how inspiring it is. You know, so we have a lot of work to do as a culture of like accepting personal responsibility for health and healing, you know. And so that's really important. And that's the fun part about traditional medicine all over the planet Earth, is that when you come to our center in the Amazon and you don't do your part, the shaman just tell you right to your face, you're not lifting like a single finger to do this. And so we advise you to leave, and if you stay, just know that you're wasting your money. But you know, me as a doctor working through a big HMO here, it's kind of harder to do that. Because they're just going to go, oh, just get a second opinion from the other one, or just complain, sue you for not covering them because they're doing their active employment. And that's a tough, you know, that we want coverage for people, we want healthcare for people, but you know, culturally we have to be able to say out loud that, yeah, you have to do your part. It's not enough, you know, to not do your part.
Should be a team.
It has to be a team, you know. That one-sided doesn't work, you know what I mean? And it's just like, just let's just say it and be done with it, and just bring it up when it's happening and say it out loud when they come in and out of the room, and tell about the doctor that's not teaming up with you either, you know. And just, these are realities. The doctor-patient relationship. Yeah.
I have a question. What is exactly your program?
Right.
You do ceremonies every night?
Yeah. So there's different centers that are doing different programs. So I'm just a consultant for this center now. I was a business partner at the center for 6 years, and they're continuing with the same program that we did, which was, and what these people were doing, they're going down. They're doing traditional, so there's a diet, you know, there's a restricted, very restricted, so you have to want it. So you're going to go there, the Indians are going to say, the natives, the Amazonian, the Shipibos are going to say, okay, to do this treatment, you're going to have to clean yourself out. So no salt, no sugar, no oily foods, no spicy, no red meat, no pork, no sex, no alcohol, no drugs, like just to come in the door. And to make it worse, to do that, you got to do a vomitive to just say, I want to be here. So you drink some plants to make you throw up, to clean out your stomach and your, you know, your whole being from whatever you had, you know, before you came. So now you're in a diet. So that's the traditional diet in that culture, which they say is the belief is that that's extremely important for the plant medicines which are very subtle, to work. That you can't just mix that with a cheeseburger or in a beer. It's not going to penetrate. You know what I mean? So you have to respect the plants. If you want to use subtle energies, you have to open yourself to subtle energies. So that's one thought. And then you're there, so then you consult with the shaman and the team to talk about why are you here. And then from that consultation is determined that perhaps you're going to be given another plant to take during your stay, like a medicinal plant that's not psychoactive, that's just there for its spiritual properties or possibly physical properties, potentially pharmacologic properties. So you're going to be dieting that plant in that restriction for, whether it's a week or 10 days or 2 weeks or longer, sometimes 3 months. In the book, like the longest treatment that's described in the book is 6 months of dieting, and a major turnaround of the person's health. And so that's that. So then the ayahuasca. So then there's 4 ayahuasca ceremonies offered per week, which is pretty intense. It's above average of the centers down there and maybe too much. But the shaman Ricardo's attitude is, people are coming from so far away, we want to make up the time. If they're only here for 10 days, they need 6. So you do 6 ceremonies. The patient is not required to drink ayahuasca. Okay, so people are offered ayahuasca, they have the opportunity to drink ayahuasca. Many people drink every ceremony because they're there, they want to take advantage of the opportunity. Sometimes it's a little too intense and they back off, they take a break, or they drink less one night, or they don't drink. But they have the opportunity to be there. And then while they're there, the requirement is that they attend the ceremonies, go through the ritual, and are also sung to by the shamans to have their personal healing, the energetic healing through the song. So that's the program. Yeah.
So another quick question. I watched the documentary on ayahuasca, and there was some concerns as far as the reaction that people have from it and whether or not it's safe for them to take.
Right.
Have you seen any ill effects from it, and is there a risk for you?
Sure. So the ayahuasca itself, so there's different ways of making ayahuasca. The typical way in this region is ayahuasca vine mixed with chacruna leaves, just alone. Sometimes they add other things to the ayahuasca that complicate it, that make it more of a problem for people to take. In that form, it appears to be generally safe for most people to take it. Outside of like some kind of weird allergy. And then there's a few other conditions I'll bring up. But that being said, that form, it does cause a lot of symptoms. And that's part of the healing. And that's also like you have to want it. This isn't for everybody. This is one approach. And that's my point in the book, is not so much about, hey, everybody drink ayahuasca. It's more about, look at the way spiritual healing can help people emotionally and change their physical health. Like that's the concept that I want to get out there. Because ayahuasca is currently illegal here, and maybe, but anyways, and it's not for everybody. But still, these concepts that we're learning of why are people going all the way to the Amazon to drink ayahuasca, and it's like, well, because they had this emotional problem that nobody was addressing here, and nobody wanted to bring like spirituality into the discussion or their emotional life into the discussion, and that's why they weren't getting better. And there's other ways to approach it, not just ayahuasca. That being said, ayahuasca is like a very powerful medicine and can be very helpful in those kind of cases. By itself, when you drink it, there's a lot of physical symptoms that might happen, including nausea and vomiting and diarrhea and pain in your body and extreme fatigue and maybe involuntary shaking and body temperature problems, chills, heat, sweating, crying, yawning, and all the other stuff that might happen, the psychological stuff. So it can make you feel very ill, so that's part of it. That is, some people might think something's wrong with that, but that's considered to be part of the healing process. There's definitely evidence that you could destabilize somebody with a history of bipolar disorder who's had manic episodes, could be seriously destabilized by this ayahuasca. And although there's some people investigating how it might be used for that problem, still in general, it's a high risk. And schizophrenia as well, that you could be pushed, it could destabilize somebody that's doing all right with a history of schizophrenia and push them into a bad psychotic episode. And then rarely somebody who doesn't have any history of that really getting pushed into some, really tough states. That's, in my experience and what, working down there and being down there and reading through the literature, it's like, yeah, it's still, the bipolar and the schizophrenia are the big risk factors. Then there's the cardiac risk factors. In other words, you might be stressed out, you might be living through some kind of nightmare in the ceremony, and if you have a bad heart or you've had a stroke before, your blood pressure might come up during that kind of intensity, and that'd be a risk. So you do want to check for that. So those are the main things we talk about, and then there's the issue of medications. In general, down there in the jungle, we don't allow any medications because there's no real knowledge base for interactions. So the risk is just, there's theoretical, risk like, it shouldn't do anything according to what we know, but we couldn't say for sure. And out in the middle of the jungle, if something does happen, We may not be able to canoe fast enough to get you to a place where they might not have something. Yeah, exactly. The helicopter's not going to come. All right, thank you very much, everybody. Thank you, Dr. Bergman, for having me.